This is Frequently Asked Questions about Natural Migraine Relief, Episode 27. Dry Eyes and Migraine. What's the connection? If you ask a dozen people with migraines about their trigger factors, you'll typically hear a dozen or more recipes for a headache. Because it usually develops gradually, one underappreciated yet provocative factor for migraine is a reduction in effective eye lubrication. In the US, at least 5% of adults have a significant dry eye problem. If you are in this group or think you might be, and also have migraines, this article is for you. In this review, we will discuss what processes contribute to a dry eye, how dry eyes promote migraines, and how to manage the dry eyes migraine connection. Let's start with the processes that contribute to dry eyes. Your eyes are lubricated by a combination of watery and oily tear elements, which can lead to several versions of dry eyes. The first is the aqueous deficient dry eye, and this is when your eyes don't produce enough tears. Your lacrimal ducts live in the upper outer corner of each eye and produce your aqueous tears. These tears make up the middle, more watery layer of your tear film. Some autoimmune conditions like Sjogren's syndrome cause inflammation in the lacrimal gland and reduce the aqueous tears it produces. The process of reduced tear production is also inevitable with aging, sometimes noted as early as one's 40s. The second type is called an evaporative dry eye, and that's when your tears evaporate too quickly. The most common contributor here is meibomian gland dysfunction. This means the glands in your eyelids that produce the outer oily layer of your tear film don't work properly. As a result, the oily layer is unstable and lets the watery layer dry up too easily. And the third is a mixed dry eye condition when you have both aqueous tear deficiency and oil gland dysfunction. This results in both less tears and tear film instability, which is an even worse contributor to dry eyes. Now let's talk about factors that contribute to or complicate a dry eye situation. About 10% of those who have the aqueous deficient version of dry eyes have Sjogren's syndrome, an autoimmune disorder. Those with diabetes have a 50-50 chance of developing dry eyes as a complication. Then there's thyroid eye disease and chronic blepharitis, which is an inflammation or infection of blocked oil glands. Next would be deficiencies in hormones. The perimenopausal to postmenopausal time frame can at times encompass a decade, where hormonal support for skin and glands drop dramatically over time. Reduced estrogen, progesterone, and testosterone all play potential roles in dry eyes. There can be deficiencies in nutrients. Deficiencies in vitamins A and D have been associated with dry eye, and omega fatty acids can be helpful for optimal meibomian gland function. Then there's tear osmolarity, or the amount of salt in your tears. It turns out that the saltier the tears, the more likely the odds are of an associated migraine, and that's especially true with migraine with aura. Being chronically dehydrated obviously can worsen this. There are several drugs that can promote dry eyes, and they include retin A, which is used for acne, a number of the antidepressants, such as the SSRI group, with examples like Prozac or Paxil, metformin, which is prescribed both for diabetes and weight loss, and enalapril, a blood pressure medication. Additional factors that can contribute to or complicate a dry eye also include increased screen time and reduced blink rate, which allow the cornea to dry out more easily. I think all of us fall into this category these days. Wearing contact lenses, which can reduce oxygen to the cornea and also wick off some of your natural tears. Also, exposure to environmental irritants such as wind, low humidity, air conditioning, sun, smoke, chemical fumes, or heat, and also seasonal allergies. Next, let's talk about how dry eyes might promote migraine headaches. First, the excessive dryness of the ocular surface can trigger a reflex tearing via the trigeminal nerve, which could subsequently trigger auras and acute migraine attacks. And this is especially true given the prominent role of the trigeminal ganglion in the pathophysiology of migraine headaches. Dry eyes also can lead to an unstable tear film, which may affect light refraction, and this can lower the threshold for a migraine headache. And also, dry eyes and migraine can share the problem of photophobia, where an overload of light receptive neurons in your brain can promote inflammation in the central nervous system. Photophobia can promote migraines as well as lower the threshold for pain tolerance, leaving one with a greater pain burden per migraine event. Next, let's talk about managing dry eyes and the migraine connection. I'd like to review 13 options for minimizing both dry eyes and their potential impact on migraines. One would be the use of over-the-counter remedies like artificial tears 2 to 3 times a day. You can use saline or brands like Liquid Tears, TheraTears, Refresh, Genteel, or Sustain. You can reduce your screen time and or optimize hydration with eye drop hydration at the times when you do have to do screen work. You may also benefit from an office test to evaluate tear production, particularly the reduction found in Sjogren's syndrome by way of a test called the Schirmer test. And you and your doctor may also need to discuss the possibility of prescription medications such as Restasis, Miebo, and Exidra. These are all eye drops which help to resuscitate tear production capacity. You might also benefit from a daily supplement that supports omega-3s and vitamins D and A. If you take vitamin D, consider getting a blood level taken to optimize dosing, and you can find more information on that in my FAQ episode 11 entry in the Substack blog. For vitamin A, useful doses can go up to 10,000 units per day short term or 5,000 units ongoing. Women who are pregnant or pregnant expectant should not take more than around 5,000 international units a day. Also, if you're approaching well into or even past menopause, you can have hormone deficiencies that promote dry eye. Individualized hormone support can be very helpful for all epithelial tissue, including your eyes. And in some cases, it may be helpful to place tear duct plugs or to repair eyelid droop deformity to minimize dry eyes. Going on with therapy options for minimizing dry eyes, we have wearing tinted lenses when out in sunlight or wraparound glasses when it's windy. Also, to consider wearing your glasses instead of contact lenses whenever possible. keeping the total hours of contact wear to a minimum, and strictly avoiding wearing contact lenses when sleeping, even for a nap, will help protect your cornea and, and the potential for it to get dry. You may want to use a humidifier in your home, particularly during the low humidity wintertime when many people have central forced air heating. You may find that applying a warm compress for dry eyes, although a cool compress during a migraine over closed eyes may be helpful there. Uh, Obviously, staying hydrated by drinking 8 or 10 glasses of water each day and getting at least 7 hours of quality sleep each night. Those with dry eyes may find it helpful to apply an eye gel like non-prescription Genteel or Optifresh, placing a small stripe of the gel in the lower eyelid just before putting your head to pillow. I hope you find one or more of these measures to help prevent dry eye and its complication of migraines helpful. Managing dry eyes is only one of almost 100 non-drug therapy options I found over the years for migraine headaches. If you would like to understand the broader range of root cause factors that drive your migraines and then individualize more intelligently from among the many possible therapy options, take a look at my comprehensive Natural Migraine Relief for Women course with its unique migraine action plan system. See naturalmigrainerelief.online for more details.